Assalamu alaikum, my dear students of Ajman University. Today we're gonna complete the third and last part of solutions. If you recall, in the second part, we talked about oral solutions. Today we will finish the solutions by talking with topical solutions and tinctures and other miscellaneous solutions. We'll start with sprays. What are sprays when we say sprays? Here we are talking about whether the dosage form is a solution that is aqueous or oleogenous, or whether it is suspension or emulsion, يعني disperse system that contains a medicinal agent. Now, this is in the form of coarse droplets or finely divided solid particles. In this case, we call it spray, and it is mainly applied. طبعا it's applied topically, usually to the nasopharyngeal tract or to the skin. This is the usual application. طبعا most commercial sprays are used intranasally, that is to relieve congestion. Okay, when you have congestion, you're having difficulty breathing in your nose, or your nose is blocked, okay, then you might need a decongestant, intranasal decongestant. Also, these intranasal preparations or sprays are used for or to treat or to combat inflammation and infection as well. That's why they will contain antihistamines for حساسية, antihistamines, or sympathomimetic agents, that is to relieve from congestion, and to combat infection you have antibiotic substances. Of course, there are some studies because most of the application, as we said, is going to be topical and for local effect, but some studies have been carried out to deliver drugs for systemic effect, such as the use of insulin sprays. Okay. طيب إذا intranasally is one of the main application. Other application are into the skin, okay, and that is to protect against sunburn, heat burn, and usually it contains these sprays contain drugs that are local anesthetic, antiseptic, protectant, and antipruritics, يعني مضاد للحكة. اوكي. antiseptic مطهر, protectant يعني حامي. okay, it protects. Local anesthetic is to if you have pain on that area, then local anesthetic will be excellent. Other application is to the throat. Okay, is to the throat, as I said. These will include antiseptics في للثroat, to spray it on the throat. Deodorant here means not the one that you apply to armpits or underarms. No, here we are talking about deodorants for the throat itself, to remove the bad smell, and it may contain also flavoring agents, that is to relieve from a condition called halitosis. Halitosis is the bad smell that comes from the mouth while exhaling. Okay. Also, you can use these drugs for sore throat and laryngitis. Okay. Other application, topical application, is in the management and treatment of athlete's foot. Okay, athlete foot. This is, we are talking here about fungal infection. Okay, that affects the foot. They call it athlete's foot because athletic individuals, they usually wear their boots for long duration of time, their shoes for long duration of time, and this will cause fungal infection. So these sprays will relieve the area from fungal, or will treat fungal infection. What you see here is a special type of plastic spray bottles. Okay, طبعا how you do it, you open the cap and then you press or you squeeze on the body in order to release the formulation, for example nasally or for intranasal application. Now there is something good about this because they utilize what we call one-way pump system. Okay, and what this actually do اللي هي ايش, it only allows the delivery of the medication without allowing secretion from nose to get inside the bottle when it's de-squeezed or when you relieve it from squeezing. Okay, so the contents from the nose will not enter back into the bottle, and that is considered as an advantage. We have a medication or commercial product such as Nasalide. These are containing flonazolide, which are corticosteroids, anti-inflammatory. And we have also Nostrella, which is containing the decongestant اللي هو oxymetazoline. Remember, decongestant like oxymetazoline should not be administered more than about 5 days, because otherwise it will create compensation in the nose and it will actually deteriorate the congestion. يعني the nose will compensate, okay, the action of oxymetazoline, and the congestion will become worse, and you will need even larger doses of oxymetazoline to counteract the congestion. Okay, so don't use it more than 5 days. These preparations are or should be labeled for external use only or something similar. Okay, plus it should also bear the label to keep out of the reach of children. These should be there. Okay, now we will talk about another topical solution, and it's referred to as aluminum acetate topical solution. Now, what is this used for? Okay, aluminum acetate solution is astringent. Okay, it's a type of solution that may be added to abraded skin in order to coagulate the protein and form a protection layer. Okay, so it like this abraded skin or exposed skin, the protein on that skin will coagulate, forming a kind of protection, and it will pull this skin together in order to aid in the healing process. Now this preparation is applied after dilution with water. So one is diluted, one part from this preparation or this wash is diluted to 10 to 40 parts with water. It can also be applied in the form of lotion, هذا الألمنيوم acetate. Okay, it can be applied in the form of lotion, cream, pastes. Okay, these are other types of preparations. Another similar product is called calcium hydroxide topical solution. The other name for it is lime water. This is the other name. Now, when you prepare this solution, طبعا there is a special way of preparation, such as you need to have a certain concentration in this solution, and this concentration is the saturated concentration. يعني the concentration, the maximum concentration in water. Okay, that's why in the preparation we usually add initially a larger quantity of calcium hydroxide to water than that is required for saturation, and eventually we remove the supernatant fluid or liquid in order to have the saturated solution. Now we should pay attention that we should put it in a tightly stoppered container, and there is a reason for that, because if air comes in contact with this solution, it will absorb carbon dioxide, and this will lead to the formation of calcium carbonate, and calcium carbonate will precipitate. Okay, that's why it has to be in tightly stoppered container, and also should be stored in cool place. You know why? Because calcium hydroxide is exothermic. يعني if you put it in a higher temperature, you know, this might cause the precipitation of calcium hydroxide from the solution, and we don't want that, because the solution should be ish, should be saturated. Okay, if there is precipitation, then the concentration will decrease. So in order to prevent the precipitation, it should be in tightly stoppered container so that calcium carbonate do not precipitate, and also in cool place so that calcium hydroxide will not precipitate. How is it used, or for what purpose? It is similar to aluminum acetate topical solution. It's astringent. Okay. The other preparation is referred to as coal tar topical solution, اللي هو قطران الفحم. Okay, it's like a liquid from coal. Okay, coal tar, قطران الفحم. And this preparation is an alcoholic preparation. It's topical again. It contains, this is very important, the official preparation, okay, according to USP, contains 20% coal tar and 5% polysorbate, اللي هو tween 80. This is a surfactant. The content of ethanol in the preparation is about 81 to 86%. What is it used for? It's anti-eczematic, للحساسية السكن. Okay, when there is redness, itching, etc. In this case, you will dilute the topical solution of coal tar. You will dilute it with 9 volumes of water and apply it either as such or in combination with other agents in lotion, ointments, etc. Okay. Another type of topical solution is hydrogen peroxide topical solution. You can find hydrogen peroxide in Carrefour, in Lulu. You will find that with a concentration of about 2.5 to 3.5%. It's very well known that hydrogen peroxide has local anti-infective use. It can be applied to the skin and mucous membrane. Some people even use it in brushing their tooth with toothpaste, okay, in order to whiten the skin and remove اللي هو stains from the tooth. Okay. Now in a higher concentration, it's also used in the treatment of acne. This is the hydrogen peroxide. Another solution is referred to as chlorhexidine gluconate solution. This one has broad spectrum antiseptic. يعني it kills variety of microorganisms. It's used in human and also in veterinarian medicine, يعني in animals. It's used as surgical scrub, يعني في تنظيف things that are related to surgery, okay, like hands, skin, where the incision will happen. It's a general skin cleanser. It has been also, or there is a preparation which is prescription only preparation اللي هو for mouth, okay, to treat tooth, الانتي plaque اللي في التooth وانتي gingivitis. Okay, this is what you see here in the photo. You see the plaque and you see الحساسية اللثة. Okay. والبلاك اللي متكون that is formed at the base of the teeth. We have also another preparation which is referred to as povidone iodine topical solution. طيب شو البوفيدون؟ Do you remember it? It's polyvinyl pyrrolidone. It's polyvinyl pyrrolidone. This is a polymer. So we are adding iodine to this polymer in a concentration of 10%. Okay? So iodine in the polymer is 10%. And we are having this aqueous preparation. The reason why we have this complex of iodine and pyrrolidine is to provide iodine slowly, so to release the iodine slowly when applied to the skin. What is it used for? It's antiseptic. It's used topically surgical scrub. It's non-irritating antiseptic solution. Example of that, betadine solution. Okay. We have also thimerosal topical solution. Thimerosal, I want you to remember this name well. It's an organic mercurial antibacterial agent. Okay. إذا هو compound زئبقي organic عضوي زئبقي. Okay. It's antibacterial and it's also mild fungistatic agent. Okay. It has this property, so it doesn't allow bacteria to grow and also for the fungal to grow. Okay. طيب also this is used or this has been used as preservative في الvaccine and other biological products. Okay. طيب what do you use this topical solution for? You use it in addition to using this one as or in vaccine and biological products. You can use it to disinfect skin prior to surgery. You can apply it to wounds and abrasions. Okay. You can apply it to eye, nose, throats, يعني mucous membranes after you dilute it, so that thimerosal is in a concentration of 1 to 5,000. Okay, 1 to 5,000. شوفوا هنا ما في عندنا W by V or something. Okay. طيب إذا this is regarding thimerosal. What you need to know is that thimerosal can be affected by light. This is the reason why it should be stored in a light resistant container. Okay. طيب other preparations including vaginal and rectal solutions. Okay, vaginal and rectal solutions. We'll start with vaginal preparations اللي هي we call it vaginal douches. Okay. طيب vaginal douches is used to clean the vaginal area and deodorate that area. It's applied in the form or in different forms. We have, for example, foam, we have solutions, etc. Usually the preparation comes in the form of powder, liquid solution, liquid concentrate. طبعا liquid concentrate, it means you need to do dilution. Powders means you need to dissolve it in water. Usually the volume is about a quart. Now you need to Google this and find out what do we mean by a quart, what do we mean by a pint. Okay. طبعا a quart, if you do the Googling, you'll see that quart refers to 946 ml approximately. Okay. It's usually applied in the form of warm preparations. It's to cleanse and rinse the vaginal area. Okay. طيب we talked about the vaginal preparations. Now we will talk about rectal preparation solutions. This comes as retention enema and evacuation enema. Both are different. Okay, retention enema is when the solution is administered rectally for local effect in the rectum. For example, when you are using hydrocortisone or anti-inflammatory drug, as in the case of البواسير, hemorrhage, okay, hemorrhoids يعني الهemorrhoids. So you use anti-inflammatory drug for local effect, or it might be used for the administration of drug for absorption, زي for example aminophylline اللي هو similar to theophylline, which is used in the case of asthma, or aspirin, or some other drug like paracetamol can be administered rectally for systemic absorption. These are retention because they are retained, they are not supposed to come out. Okay, so it's either for local effect or systemic effect. Usually the retention enema is containing few ml only. Opposite to that, we have evacuation enema. Evacuation enema is when we want to clean the colon, we want to clean the rectum, maybe for examination, or maybe because the patient is having constipation. Okay, in this case, a larger volume, maybe more than 100 ml, is applied. But how is it applied? You have a plastic squeeze bottle, and in that plastic squeeze bottle you have a solution containing a buffering agent and other materials that are squeezed into rectum. Okay, first you would need to insert the tip of the squeeze bottle into the rectum, and then apply pressure steadily until you feel that your rectum is full. In this case, you remove the bottle and you evacuate any stool that is there. Okay, you have to tell the patient is that they don't need to administer the whole liquid. If they feel that the rectum is full and it will explode, the pressure is enough for the stool to come out, then they can stop and they can allow the stool to come out. Okay, so we were talking about topical preparations and tinctures, or topical solutions and tinctures. Now we will talk about the tinctures. One of the tinctures is referred to as iodine tincture. And if you remember, we said tincture هي عبارة عن alcoholic extracts from vegetable or from chemical substance. Iodine is chemical هون. It's an alcoholic preparation containing, شوفوا, 2% iodine and 2.4% sodium iodide. It's like potassium iodide. Here we have sodium iodide. طيب, if you remember, we said if we want to dissolve iodine in water, it will not dissolve well, and that's why we need sodium iodide. But we don't have this problem here if we are going to put it in alcohol. Okay, we don't have this problem. Okay, طيب, so why do we need to add sodium iodide and get sodium triiodide? Why do we need to do that? There is a reason for this. Actually, there are a couple of reasons. The first reason, yes, iodine will dissolve in alcohol, there is no problem about that, but this might lead to the formation of ethyl iodide. If I just use iodine in alcohol, we will get ethyl iodide. That is not desirable because it will lose its antibacterial activity. So in order to prevent that, we need this to form, and this will prevent the formation of ethyl iodide. Okay, this is number one. Number two is usually when we apply this iodine tincture to the wound or affected area, usually before application we usually dilute the preparation, or maybe add little bit of water, And if it was only iodine and we are adding water, yani we are diluting it with water, there is a possibility that iodine will precipitate. So in order to prevent this precipitation, we need iodine to be in the form of sodium triiodide. Okay? طيب. So what you do, you take 2% iodine, 2.4% sodium iodide, you put it in half the volume of the tincture. Let's say the tincture is 100 ml. You put it in 50 ml of alcohol, and then you dilute the rest with water, and you will get something between 44 to 50% alcohol. Okay. So what is it used? It's anti-infective agent. The nice thing about this tincture, this iodine tincture, is that it has brownish reddish color. So when you apply it to the affected area, this color will delineate the application area, so you will know where the iodine covered, or the iodine covered what area, because of its color. Okay. Okay. The other preparation, tincture, it's coming from the maceration نقع يعني of compound benzoin. Okay, this is from a plant. You macerate it in alcohol to make what is called 10% benzoin. إذن هذا another tincture from vegetable source prepared by maceration, okay, in alcohol. طيب, what is this benzoin used for? Benzoin is categorized as protectant, so it protects and toughens the skin. Okay, so for example, if you have ulcer, because you know some people they sleep for they have, for example, they cannot move from the bed, so they sleep on one area for a long time, causing skin ulcers and bed sores. Okay, you can apply benzoin tincture for that. Also, nursing mothers who breastfeed their babies, with breastfeeding they will be suffering from cracked nipples, okay, from the babies, and applying benzoin tincture will heal the nipples and will make them tougher. It can be also applied to lips لما يكون في fissures, okay, يعني broken skins, and to the anus for the same purpose. In addition, benzoin, okay, has a smell, and when you add it to warm water, you can smell it. Can be used as inhalant in the cases of bronchitis and other respiratory conditions. يعني when you have coughing, for example, and sputum, etc. Okay. طيب, the problem with compound benzoin tincture is that it has to be protected from light. This is one thing. Okay. Plus, because it contains alcohol, it should be stored in tight container and avoid excessive heat. طيب, miscellaneous solutions. These include aromatic waters. Aromatic waters عبارة, they are saturated volatile oils or other aromatic or volatile substances, يعني something that has nice smell. طبعا you know that it will be difficult to dissolve a volatile oil in water because they don't like each other. That's why, although the term here is saturated, it doesn't mean it's concentrated. Okay, but we try to dissolve as much as possible. These aromatic materials, the materials that have smell, include orange flower oil, peppermint oil, spearmint oil, wintergreen oil, camphor, chloroform. These will give nice smells, and these waters can be used as vehicles for perfuming and flavoring. Okay, similar preparation, but there are some differences. طبعا according to composition اللي هو الspirits. The spirits also contain aromatic and volatile substances similar to aromatic waters, except that here the vehicle is hydroalcoholic solution. This is number one. And because we are using this, we are able, not like water, here we are able to dissolve much larger quantity of the volatile substances. Okay? Now, how much or what is the percentage of alcohol in spirits? Usually it's high, over 60%. طب what spirits are used for? It can be used as flavoring agent, yes, but also some of the aromatic solutes, they have therapeutic values, they have clinical use, such as, for example, when you apply or you add drops of this solution in warm water and you inhale the vapor, okay, for bronchitis and other or apply it externally on the skin. Okay. طيب liniments. شوفوا, when I say liniments, I want you to think here about pain in your in certain areas. For example, you have pain in your muscles, you have pain in your back, etc. Now these liniments are of two types. One type is alcoholic, okay, the other type is oleogenous. Oleogenous is nice because when you apply it to the painful area, it will allow you to do massage, okay, it will allow you to do massage. Massage is good in these areas. When it's alcoholic, okay, then it will help produce or cause or be used as rabeficient, counter irritant, or for the drug that is dissolved in alcohol to have a penetrating action. Okay. Rabeficient يعني it causes irritation in that area and it causes more blood supply, so you don't feel a lot of pain. Counter irritant, to counter the irritation or the pain that is in your muscles. Okay, so it causes kind of irritation, so you will forget about the pain in your muscles. Is an oleogenous when massage is more required. Okay, it's alcoholic when I want the penetrating action, the counter irritant effect, and the rabeficient effect. طبعا you should not apply the liniments to broken area. This is number one. Number two, you should not apply it also to bruises. Okay, يعني not only broken but maybe bruises. Okay, I'm talking here about applying it to when you do a lot of muscular work and you have muscle pain, okay, but not bruises. Okay. طيب collodions, this is a special type of preparation. Usually it's little viscous, applied onto the skin for protection or for occlusive effect. Okay, what does it mean? It means it has a volatile vehicle of alcohol and ether, هذا الvehicle, into which you are dissolving pyroxylene or what we call nitrocellulose. You are dissolving this polymer. So you are dissolving it in this volatile vehicle and then you are applying it to the skin. Good. So what happens when you do that? When you apply it to the affected area or to the certain area, the vehicle will evaporate, leaving a film of pyroxylene that will cause the occlusive protection coating. A film that will protect that area from external environment like humidity, sun, etc. It's kind of protection. Okay. Now, if there is a drag, additionally, it will cause the medication to stick firmly in that area. Yani, if I'm adding, because this pyroxene is not a drug, it's just to cause the formation of the film. If you add a drug, then it will cause the drug to stick in that area. Now I will show you this preparation. This is a collodion, and it's used for the treatment of warts, corns, and calluses. What did they add? They added salicylic acid and lactic acid. Now, what will happen في الكونز والكلاوسز اوكي and warts اللي هي viral dimples, corns and calluses, when there is friction in the skin and you start getting a thick skin and you want to remove it. So if you keep the acid in that area, particular area, for a long time, then it will hydrate that area and then it will allow you to remove the corns and calluses from that area. Okay, such preparation must be labeled for external use only. إذا شو هو الكولوديون؟ Collodion is a volatile vehicle consisting of alcohol and ether into which you dissolve pyroxylene. If you need to add a medication, then you can do that. But this preparation, collodion itself, is to ish to protect the skin, and if there is a drug, to keep the drug in attached firmly to that area. Okay, and by this we have completed the last and final part of solutions. Best luck to everyone and have a nice day.